Yeah, but we have to start.
No, that's good, thank you. Do you know anything about this?
Yeah.
Do you, well, fix it then, because we can't get it to pick up on her computer.
Not addressing at all.
Not so much, but we're working on it. How are you? I haven't seen you forever. I'm good.
You put that in video survey, and then
I think I'm gonna
go back to
get
input
my
A.
old map.
I haven't been out for a long time.
In DC, which is fine.
For who? That's my daughter.
Switch over to.
25 years to be retired. Well, 17 years, and then he left and went and taught at medical school in Charlotte. And so, and then he retired, so now I go to his office. His office isn't there. And that was real strange because she went through Harris Middle School and I was assistant principal there. I said, the first time I went to see her, I said, you know, this is really strange for me. She said, you can imagine how strange it is for me.
Joe, aviation, radio service. They fly around Atlanta.
Hello there, I woke up at 5 o'clock this
Better
morning.
mind than mine.
Yeah.
Yes.
We've got out of town coming. Roaches told us about it. Rotary, no awards. So I need to counsel on our.
You coming off the list?
Yeah, hey,
That costs double, I hate to say.
I have to tell you, Barbara and I have been looking forward to it. She said, Bill, I thought you knew what that schedule was. I said, Barbara, I'm going down to Florida for 2.5 weeks to redo
Well, when they
all.
come in the line.
I said, that's all I have to say.
They come right
I hear you. Anyway, I'm sorry.
No, that's okay.
So if I see Barbara,
There's
I'll
Randy.
make sure to do that. Is this it?
So far,
So far.
yeah.
In fact, you went to Waxhaw over the summer, and did a lot of.
That happens.
I'm still open for the boat trip.
Yeah. When did that?
Oh, we are.
And then what?
There's no date set, but apparently there are 3 volunteers for boats. And
Yeah.
I want to go see the lake.
I've been
I
on
haven't
that.
either. I've lived in Spruce Pine since 1975.
You kidding?
And I've never been to Lake James.
I was on it a couple of years ago. With Jordan Gill, you took the boat back down Pettisville.
Took your ticket
Years
away,
ago,
right?
they used to have a
Speaking of
fundraiser
George, he's
where they would have spaghetti.
He'll be here. We were gonna get a ride, and I told him, I said, well, I'm not running errands, so can't get a ride on that.
So,
Who is it?
59.
Yes, but I sent the link, but it was the link for the last meeting. And so I got on and I'm looking at it and there's Chuck talking, and I'm like, I thought we were meeting like on the road, and when he was up here, and going on, I'm like, oh, shoot, I go, I sent the wrong link. And I got back on the email, I'm looking, and he already sent a link that he sent. I'm like, oh, okay, good. I jumped into that. There was like 7 people in here doing it.
Anybody that had not been?
Tanya Hale was there.
Good,
Tina was on it.
good.
Bob was on it. I was there as Travis, and there was somebody else. I can't
Big
remember.
stuff, I see 130.
We have a stand there Tuesday night.
Well, go see it. We would accept
Where are you gonna be in?
No, for a while.
Oh,
Barbara and I are prepared to make a contribution.
Here? I think so.
yeah, you're gonna. Anyway, you won't get it.
Did you get my email about the
Yeah.
Yeah, survived.
Are you able to open it up?
Yeah.
Yeah.
Were you able to edit it? Or was it a PDF?
No, it was an Excel.
Oh, was it?
Like this.
I went through that whole
Together
thing,
around the.
translated it all back to Excel. There was a nice template that they had for something else. I'm like, ooh, that looks
Oh,
just
yeah,
like
you
that.
got-
We'll keep that. It wasn't on my list. But I figured
It's a fresh start anyway.
yeah. I mean, it's an easy add. If you know the number, you can just like put them back in and fill it in. And we can cut and paste and keep doing it. You don't have to do
For the orchard, it's at two,
I'll cut you down for two. Okay, you want to pull the?
Yeah.
Oh, okay.
Yeah.
I'm trying to help let Randy see there's people here.
I can just show it to them. Oh, okay, I'll do that. Perfect, thank you.
Oh, I'm good.
I called up, oh, go ahead. I called him up on the ticket, you know, and I said, hey, I said, my buddy might just went down to you guys, and I said, I got mine like a week ago. I said, like $3 for this, another 70 cents for that.
Yeah,
But he was in Oregon, and he goes, I think I know why. They price match your so if they're selling it at a discount, you still will cash it. And I said, well, what I gotta do for you? He says, well, bring your receipt back, and then, he said, we'll price it out. I said, okay, I get my buddy's receipt, bring it down to you. He goes, yes, that'll work. Because I went down to the auto parts today, and I ended up buying some. I think they're fair. They were combo wrenches. Oh, I said, I always wanted some of those. Yeah. Well, somebody already spent a pay for that. You say $80. I'm going like, hey, when you get a job for a tool, sometimes you can't pass it.
My husband always said, I'm not telling how much I saved.
They don't talk to each other. They're different generations. We got some Where the volume button is on this is restaurants.
Oh, the old,
Yeah, sanitary is still there, but it's not quite the same. But, constant restaurants, you have it, it's across.
I'm thankful I can delegate it down to clinic.
Place where Rotary companies there too.
Yeah. The past 5 years.
Opposite side of the
Okay, good.
I need to put down just for the,
well, sure,
Susan, you need a chair?
unless you know, on one condition, and that is you sign up for our email.
That's the only decision you have to make, blue or black.
Well, okay.
He said one less decision.
There's always a catch.
Yeah. You know, you buy something, you have a service. Get a program, you gotta.
Come by and let one of the.
Oh, I.
Okay, who else?
Lisa Larson.
Yeah,
What I did with this list.
R-I-S-A.
Members have been longer with this.
Where have I heard that name?
Oh, God. My husband is Howard Larson. Well, she's famous, and everybody thinks we're related.
Oh, okay, you guys are related.
No, we're not, no, we're not related. Everybody, I have to tell a story, somebody thought.
Really?
Really? That she's my mother?
I would have
I
said
am not her mother. I mean, I think if I had a child, mid-teens, yeah, I would have been proud to be your mother. No, but I don't. Hey, Randy's on today.
Who is?
Randy.
Oh, good.
We started the program at 12:15.
Yeah, it's not quite there.
I'm trying to get the camera focused at the right place. I'm gonna have to lower it.
You want to turn it over here so you can see this for right now and then.
Okay, and then I'll. Alex.
Now, did you have something in newspaper for search?
Yes, there was something in this newspaper.
Alex Glover is not going to be with us. Yeah. How about George?
Big George. Big George.
Oh, no.
Come on, okay. Marvin. Marvin, you're both. That don't keep coming out, okay,
Yes, I will. Okay. Archie and I are starting to work on pulling out the deceased businesses and who's our members, so. Here past, I'm just looking at it.
When I was looking for stuff earlier in the year, I was going around. And then once we start walking around that file, we'll have, they have an update or something. More.
I know, everybody's, yeah, everybody went off too.
Say who will take this one, who will take that one.
Of course, last
Give
night.
us a solid list.
Yeah, because we gotta get some jettison off the names and remember that word, because I think the list I used was like maybe from 2017 or 18.
That's what we're doing. Businesses and old members.
Welcome, everyone. I look at this clock, it says 12:20, that one says 12:15, so I don't know which one we should be going by, we'll go for something in between. Yeah, Mr. Marvin, would you mind leading us in the word of prayer?
I'll be glad to.
Thank you.
Let's bow our heads. Dear God, thank you for this Rotary Club. Thank you for all the work that these members do, both as a part of this club and on their own. Thank you for the search organization that's helping to make our place a better place to live. Help us to keep healthy and safe. In God's name we pray. Amen.
Amen.
Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Thank you, folks. Actually, I think we'll go ahead and get started here pretty quick, since we have a meeting, we have a program.
Everybody's just talking.
But I think they're just going ahead and finishing up what they're doing, which is fine. We'll let them finish for a second. I'll take this off since I'm up here. Yeah, ladies, when you're up here, or when you're presenting, you don't need it. You can't hear you otherwise.
Oh, Randy's here.
A few good times with that.
He's on.
We'll get started.
Oh,
We'll go in here in a second.
Yep, you can do it on paper too. Because I have to know that.
Randy is person.
Yeah.
Looks like they're
Oh.
Randy? There you go. Hey, Randy.
How you doing? Good to see
Yeah,
you.
just a few minutes more before they finish eating, and then we'll get started.
All right, good deal.
I guess I need to turn my sound down. Is that better?
Are you on there, Bill? I got this one by the time. Bill, is on the email.
This is good or better.
You want to add your name?
So Robin, are you still doing anything with education?
No, I retired again. So about almost 4 years ago. Yeah. After I retired from the school system, I taught police and parade for 9 years. My plan was to stay 5.
Your time was what?
My plan was to stay for 5 years, and I stayed 9.
9. Oh.
I enjoyed it. It was great. But I was ready. Yeah. And I finally have a grandchild. Oh, after all these years.
Well, that's great. You know, I didn't know you had a child to have a grandchild.
Got 2 boys, 35 and 39.
Just when you were at Harris, you have,
Yeah.
you hid them well.
Nathan was there the whole time I was there. I left when Daniel was in 6th grade. As a principal. he was really glad.
It's hard to.
Nathan, my oldest, is the one who finally had a child.
Well, there's the other one too. Actually, yeah, our children. Sam is married, but it says he doesn't want children. And Jennifer is. So we at least have some.
Both boys are grown up, aren't they?
They're, it's not that many, although, Oscar, who's 13, is 6'1".
Oh, wow.
I mean, he gives me a hug and I,
So he got that height from his daddy.
and, Eli's his name. And he's going off to School of Science and Math in the fall.
Great. It's kind of hard to let them go off that young. But
Yeah,
it's a great
yes,
opportunity.
I know it well, but
Yeah. Did they both go? I did Jennifer go.
yeah. Is your grandchild here?
She is, they live in Shelton Moore, part of Madison County. That little club that sticks up in the Tennessee. It's about an hour. So that's not. She just turned a year old. And I keep her one day a week. So that's good.
So do you go up there?
And I'm on works from home. They probably will continue to. I think they discovered it works really well. She's too busy to take care of it. Does she know her? She's a CAP supervisor. The CAP supervisor is that people that have CNAs who go into the home and serve and from school, rest homes.
That would be something.
Yeah, she does. And she's interviewed her, but she has to interview her clients every so often. She does that by phone now. Her computer is there's still some things she has to go out to do, and what she's been doing, she has to do their mailbox, and then goes back the next day and gets it. It's worked well, and she's been extremely caring, because Ava was born during COVID. She hasn't seen very many people in her life. She has not seen very many people. Not much more than mom and daddy and grandma. And granddaddy.
So, you have a granddaughter?
Yes. I have 2 boys. We finally got a girl.
Stoke up his
Yes, well, I saw that you wrote it.
Yeah, like money to deposit.
Yeah, it counts towards, you have to use your fund, and we're the only organization.
Oh, okay. I didn't know it got put in.
All right, guys, I know we're not all quite finished eating, but for the sake of our presentation, we don't want to carry too long. So go ahead and finish eating, but we'll get started with announcements and happy dollars and so forth. So I know Floyd, you had said that you had some announcements.
I do. I talked with, I called Darlene, she's not called me back yet, to make sure that we could use the field on October 2nd, that she's doing Richard's job. Of course, I previously talked with Richard a long time ago, but I wanted to talk with her since she's the new town manager and to get specifics, just make sure she knows exactly what's going on and everything. So I'm sure she'll call me back. I've got an email ready to send to Main Street to Libby just as soon as I get the okay for the October 2nd date. It's got our meeting schedule asking if we could use the meeting room approximately every 2 weeks. June 30th will be the first. 12:30 is their time that we've decided to do. Yeah, a week from 2 weeks, June 30th. Yeah. So right now we just, trying to solicit sponsorships is still the big thing, and it will be the biggest thing probably right up to the festival. And assuming that everyone is still available that we've used before and for different things, that there's possibly availability. Some of them aren't in business anymore. That's one problem I'm having with my business is getting supplies. People just gone, just totally gone. So that's where we're at right now for the meeting schedule for 12:30, June 30th. If for some reason we can't use Main Street, we'll find somewhere else. If for some reason we can't get the date, then we'll hustle up and meet a little bit earlier and figure out a different date.
So that's Wednesday.
Wednesday, yeah, Wednesday, 12:30. That'll be our new time.
That'll be our standing meeting.
That'll be our standing time, 12:30, yeah.
Every other week?
Approximately every other week, yeah, after that. Actually, I think what I scheduled is exactly every other week. And then I thought on the 30th of September, that's the Thursday before the festival, that would be a barbecue day for the club here, like we usually do. And I will send all this out as soon as I have approval from both the date and the meeting room. As soon as I don't see a problem either. I think we'll get okay probably before the weekend. Questions? All right.
No, thank you.
Thank you.
Thank you for all you're doing on that. And I'm sorry, I was derelict in my duties. I didn't introduce our guests. We have some guests today besides our esteemed speakers, Rita and Risa and Susan Larson. But also we have Mr. Colby here. Colby Paulson from the hospital. You want to stand up and introduce yourself?
Yeah. So, my name is Colby Lawson. I do work at the hospital here in Spruce. I'm just telling March, I've been with the hospital for about 10 years now. So I've done several different things in my role at the hospital, and currently I work very closely with Tanya, more on the business development side. But started out actually in HR, then assumed the volunteer services group. And now and then I moved into public health, and now I'm really focused on kind of business development and growth because COVID really set us back last year. So we're just trying to make sure that we're capturing, what we can in the community and helping folks out as much as we can. And we've been really busy over the last few months. I think a lot of people just delayed their help. Y'all can probably attest to that. So we're seeing a lot of increased volumes, and we're staying busy. But I'm just here as a guest filling in for her today, and I appreciate you all the warm welcome. So,
Sure. Thank you, Colby.
you're welcome. Thank you.
Thank you. And I think part of that, the discussion, we'll get into it here in a moment about our Tuesday night social that we had, but one thing that came up on that was the cataract surgery that's coming. I don't know if you all want to mention that because we're the age around here that might be interested in that.
I'm giving an update.
Sure.
Dr. Bortal's going to be, everything lines up. She's going to be working out of the Grassy Creek Clinic. That's where the clinic will be based out of, and then she'll be doing surgery. We're shooting for around the 1st of September, unless you've heard anything different. But once she gets here, she's going to have to kind of build up, some patients, and then at that point, we're hoping that by September, around that period, she'll be in the OR. And so we currently also, today's a cataract day at Blue Ridge as well. So we have Dr. Joseph there today, and he's doing, I think, 11 procedures today.
Wow.
So it's going to be great having that extended capability because it's been pretty limited, just with Dr. Joseph being there. So we're excited about that.
And then there was mention about pediatric dentistry.
Yep, so I believe Dr. Green possibly.
Yeah. Dr. Green is with MCHP.
Right.
He's
So-
our dentist.
We're actually talked to Tony about it yesterday, so we're gonna set up a meeting and hopefully get the credentials rolling on that and
Mhm.
figure out what we can do to get him in the OR doing those cases. And we've also been working as well with Dr. Townsend, and we kind of put that on hold just for a minute, but Dr. Townsend, I think, is ready to revisit that conversation, and hopefully we have access to several pediatrics.
Yeah. And our, Dr. Green at our shop, it was announced last week before last, that we had applied for and were awarded a $400,000 student oral health grant so that he can go out into all the schools in Mitchell and Yancey County and provide dental care for the students. So we're very excited about that. That's a 2-year grant, and finally get the chance to reach out into the clinics or to the schools and work directly.
What is it from? The grant?
Oh, yeah, that's from Office of Rural Health, I think that's who we got it from.
North Carolina?
North Carolina, yes, sir. Yeah.
And
I'm
we-
sorry, we have a lot going, a lot of different grants. I just know we got it. Yeah,
There's so many grants.
there's so many. I mean, this year there are. There's a ton of grants out there this year, that's for sure.
Judge, we actually already have the approval for the equipment, the image equipment that needs to be used for those cases. So I think we'll be in good shape.
Yeah, we're working on the van and all that kind of stuff. So we got to carry the exam tables out for chairs. So I guess I should do a happy dollar about that, shouldn't I? But any other that to come? Any other announcements? All right. What about the happy dollars?
Who's got a happy dollar? I've got two, one for Rita and one for Susan. Sorry.
Thank you.
Wow.
I'll owe one, but I don't have a dollar. I guess I could do a $20. That's not that happy.
I think I'm gonna need some prayers for next week. I got about like 8 guests coming on Monday, possibly Tuesday, for about 3 days. So happy to see everybody, but whoo, that's gonna be a lot of folks.
Okay, who's happy?
My wife and I are happy because we deposited our 3 grandboys back with their parents Sunday after 7 days.
Yes. That's our big happy dollar.
Big happy dollar. And it's for the
Oh.
Marvin.
Yeah, I'll give you $1. I like summer weather and I like today. I got to do some stuff out in the yard this morning. It was great, so.
We just want to see you walk a little.
I've
been at it.
We've got a second serving. Pass it.
Sure. Next week, I will be taking my first class in Finland, how to do timber frame.
Oh.
Excellent.
Fun, timber frame.
I'm not sure it's happy, I've never done it, but the following week I will tell you how.
Yeah.
That may not be happy. It's a week and a half.
And I'm happy because I figure I could probably offer him the ability of a cabin for free.
There you go. Not sure it'll be standing.
I'm happy because we just celebrated our 52nd anniversary.
All right. Putting up with you for over half a century.
Half a century.
Yeah. That's awesome.
Just want to remind everybody about next week.
What's next week? Oh, yeah. I'll get into that. I'm sorry.
They want to sign up.
Yeah, well, I've also got a list up there. I'm sorry we're spinning you around, Randy. We have Randy on the zooming in with us. And so we're trying to be a little bit more conscientious about the camera. So yes, next week we have the 24th, next Thursday night is our installation dinner out at the Orchards. Bill could be here today, but we've got music starting at 5:45. Dinner starts at 7. So we've got plenty of time to get there to enjoy and mingle and mix beforehand. Right now we have We had 29 so far. Unfortunately, we had a couple that had to back out, something came up.
I think we're down to 27.
We're down to 27, but I've got one more, so that'd be 28. And so we thought, it was suggested that, we had the list that Nelson sent out for the social call that we had on Tuesday, and I need to talk about that too. But he sent that list out with all the names on it. And so George has a suggestion, well, maybe we look at who's on the list, and who on this list is not on the list that's attending, and we'll give them a call and see if, just to remind them, because there's some people here that we think probably, maybe they want to be on the list, but we've got to get it done today, because we need to turn in, we have until early next week to turn in the numbers to pigs and grids. It's not like I have to, but we said we'd wrap that up today, try and get it done. So does anybody want to, I'll take a few of these myself. I'll take this sheet and work it this afternoon. Anybody want to take this sheet and look at it and compare the two, this one?
What sheets are you talking about?
Well, this is the phone number. This is the list of club members and their phone numbers in contact. And you can compare with this sheet that has a list of who's attending. And so if they're on this list and they're not attending, then we'll give them a call. How about that?
I'll be glad to help.
Glad to help. Okay. Well, we can work that out together also. So we're very excited about that. That's a meeting. And then Tuesday night we had the social call. Didn't have a huge number of people on there. We had 7, I think, 7 or 8. But Tanya was on there. Tanya Hill, who hadn't been coming to the meetings, hadn't been able to come. And then Tina was on there also. She's doing well. She said actually things are loosening up a little bit maybe, and she's going to be able to start attending. And so we're hopeful along that line. But we had a nice visit. Yes, sir.
We might have got more, but when I sent the email out for the link, it was the link for the last meeting. And if you got on and looked at it, you know, what the heck is Chuck doing there in front of the Presbyterian Church?
Yeah.
So that part was my fault.
Yeah,
We might have had more.
Yeah,
It's their own version of cyber warfare.
Yeah, once we realized when we sent out sent out a Zoom invite, and so we did get other people to show up. So it was good. It was a good meeting. All right, so we have spin the wheel.
You're up.
You get to spin it this week.
I get to spin the wheel.
Pressure's on.
It's a hard
I
one.
need somebody to.
You can do the supervisor.
You want to know what number it draws? Yeah.
I will.
I am arranging for the right number.
What's the right number if it's one of these?
Jack.
Do we do it again?
Spin again. Spin again.
Come on, George. You
And
want to ride
Jack
home?
was 39.
All right. All right. So now we get to introduce our speakers. Very excited about this. I think a lot of folks already know these two fine ladies, Susan Larson and Lisa Larson with Search. And you're probably familiar with Search. Search has been around since the start of the sale of HCA and, Blue Ridge Hospital, purchased by HCA. And I've been working with them for years. I can't tell you, there's a more dedicated group of ladies to do what they have done, and the stay at itness and the doggedness of holding people accountable in the community for the health care that we need in our community and the organizations, and fighting for things in our community. So I just can't say how much I appreciate all the work that y'all do. I'm so happy that y'all are continuing and moving on, and that it didn't just die by the wayside with the purchase of it by HCA. Of course, we know there's a lot of things that and Kobe don't listen to us, but we know there's a lot of things that, still need to be done there. We're not where we need to be in the community with HCA, so thank y'all for all you do. So, with that, I'd like to introduce Ms. Susan Larson and Risa Larson from Search to tell us what Search is doing now.
So I'm real worried about our setup over here. So Susan, you gonna sort of cover for me till we get this going?
So when we get this going, we may need to kind of group up on one side of the room so everybody can see and hear a little bit better.
Yeah, you're not gonna be able to see unless you come over here.
I mean, I can turn it. I don't know which is the best. I mean.
That's fine.
Well, that's not gonna work for them.
Then we'll have to, you see? Well, not on yet. What we're trying to show you is something that we prepared for you a year ago. Actually, when, just before COVID hit, there was an initiative from the Dogwood Health Trust to ask for a modest amount of money, which we did. And then COVID came, and the money, half of it went to preparing video, PowerPoint materials to talk about who we are and what we do. But guess what? We haven't been able to tell you. We finished that a year ago. It's on our website. You can see it under who we are at the top of our website, and you have the address there. But we're really excited to have a live audience, even if you can barely see it and hear it. I hope you can hear it. I think it's a wonderful combination of local images and local music and local thoughts and concern. So
I didn't want to go over you, but I don't know if this thing is on.
I was gonna say, I'm afraid for our viewer on the Zoom, you're probably not gonna be able to see it.
It's just reflecting what's
Randy,
outside
I'm
the
sorry.
window.
Okay.
Well,
There it is.
Next, our community. So sorry, I'm going to start it over just real quickly so that we can start at the very beginning.
Okay.
If there's any luck, please, dear God.
It's a 6-minute video.
Search. Letters in the name stand for sustaining essential and rural community health care. The people of Search are your friends and neighbors. Search connects our communities, the towns and crossroads, from one valley to the next. We want to bridge the gaps. We aim to foster and defend the health and healthcare needs of citizens in Mitchell and Yancey counties. Now, first we invite you to share your experiences and hopes. Tell us what's important to your health. What's going on in your community? What's missing? What happens when you go to the doctor, to the ER? What's working? What's not working? Second, based on what we learned from you, we then work to educate ourselves on problems and explore how we might improve the system together. What are the best practices, options, and new trends in rural medicine? What are other rural communities in North Carolina and beyond doing to solve the same problems? Then third, we will advocate for changes in and improvements to the system. We will support our healthcare providers, first responders, nonprofits, grant makers, and others. Our job is to present information, encourage action, and monitor progress. Share, educate, and advocate for rural community health. That's what we do. Our grassroots effort emerged out of concern that Blue Ridge Regional Hospital was on the road to closure when the Labor and Delivery Department was eliminated in 2017. It seemed unthinkable. Our beloved hospital opened its doors in 1954 and has served our communities with heart and courage for more than half a century. From the very beginning, our hospital attracted highly qualified physicians, nurses, and technicians with a passion to serve rural North Carolina. Our hospital has now been purchased by a national corporation, HCA, And we want to ensure that our medical professionals, doctors, nurses, technicians, firefighters, EMTs, and ambulance personnel all have what they need. We want to protect those who protect us. We want health care that puts people ahead of profits. We value healthy living and we love our mountain life. Search works across counties and in partnership with all our health organizations and government officials. We are nonpartisan and we are nonprofit. Every voice matters. When we pull together, we can make a difference. It's really hard to keep up with what's happening in a continually changing healthcare system. Our advocacy significantly improved the terms of the hospital purchase agreement, extending the guarantee that Blue Ridge Regional Hospital will remain open for at least 10 years. We invite experts to help us all understand our challenges and options in clear and simple language. We've even reached out to national experts when we've needed them. We encourage participation in meetings with the independent monitor, whose job is to ensure compliance by HCA to the terms of the agreement made with Mission when our hospital was sold.
This is My Health Matters, a public service of Search in partnership with WKYQ.
We work to keep you informed about any new developments in hospital services and other health challenges.
Our guest today is Katie Lewis, Mitchell County Liaison.
Here's what you can do. Be the eyes and ears of your community. Let us know what's going on. Let us know what is important to you. Tell us about the health heroes in your community, people who are working hard to keep us well and safe. We want to shine a light on their good work. As a response to COVID-19, Search has distributed packets of encouragements to frontline workers, a token of our appreciation. Our communities now have access to foundation funds focused on making us all healthier. Search stays current on their guidelines and shares that knowledge with you. Through Search, you can offer your time and talents to help us spread the word, and you can make donations to support our work. Please visit our website, searchwnc.org. Sign up for our newsletter. Send us an email. Join us for a meal and a meeting soon. Search aims to sustain our high-quality medical care and to keep it local, accessible, and affordable for all.
What's a fellow, Susan? Can we go ahead and pause?
They wouldn't be able to read the first
Yes.
three slides, so, okay. We have some more pictures, but I'm going to do some talking because there's a lot of text on the first slide and you can't even see it. So let me just tell you what's on it. I wanted to inform you about what we've been doing in the last year during COVID. We've been building our foundation and we got nonprofit status just over a year ago, and formed a 13-member board from Mitchell and Yancey counties. And actually, George Walter is part of our initial board. So we're glad to have his expertise and brilliance chiming in. We've been fortunate to get grants from, I mentioned the Dogwood Health Trust, AMY Wellness, AMY Wellness Foundation. And just today, it was announced publicly, we knew it previously, that the Z. Smith Reynolds Foundation chose us as one of 32 groups in North Carolina to be funded in their community progress grant. And we're the only ones in Western North Carolina. The great thing about it for us is that it's going to allow us to hire some help. And we're looking for a half-time person right now to be an administrator and also a bookkeeper to keep up with things as they go forward. So we're very excited about that and pleased to have been chosen for this. Also, the Yancey Fund has chimed in, and individuals and our board have been funding us right along. So we're very grateful for the support of the community. We relied on having a basket out for all of our meetings, and that brought us a fair amount of income, but it's nice to have a little more of a foundation. What do we do? Well, we speak up for healthcare, and we meet with Tanya Hale about every 6 or 8 weeks. Been by Zoom lately, of course, but she's been very informative and willing to share. Rebecca Carter before that. You'll hear more about the independent monitor. We try to keep up with what's going on there. We're promoting vaccination clinics. You'll hear more about that. We celebrate health heroes, and you heard about WKYK. We have a feature on there. They're kind enough to air interviews with healthcare folks, mainly during COVID. We're hoping that will continue. And we're sharing materials from North Carolina Department of Health and Human Services on the vaccine. And so you'll hear more about that now. Another big part of what we've been doing, and you saw some of it in the images, was that we've had listening sessions to find out what the needs are that people perceive in healthcare in the community. And we feel that going to them in their local setting, be it a fire department, a community center, a church, is the most effective way to do it. We did that for 2 years, and now we've morphed into another program called the Community Engagement Program, which is just getting started and will be helped by these grants. And I think we can go here to the pictures, how you can get involved with search. We have some pictures of things that you can do. You can be the eyes and ears of your community. And I'm hoping you can see some of these pictures because they're people you know, I hope. One, this is, let us know what's going on. This is Tipton Hill. We did a listening session in Tipton Hill. Tell your own healthcare stories. That image is from Trinity Episcopal, which is one of the places we meet in our alternate county-to-county meetings. The next one is join us in listening to the community talk about local healthcare. And that image is from Grassy Creek Fire Department. We went there for a listening session. And then one of the arms of our organization has been researching where in North Carolina healthcare is being done particularly well. And so this image, which you can't see much of, shows the locations we've been talking to. One is in Edgecombe County, Tarboro. One is McDowell, has a very robust community organization focused on healthcare. And Gaston County and Madison County is another place that's really done well, got national recognition for the way that they manage healthcare. So we're talking to them. We hope you'll share your special talents and interests with us, get on our mailing list, come to the meetings, better yet, volunteer, and share what you know. If you're not on our email list already, we hope you'll sign up. And we haven't had our first in-person community meeting, probably in the fall. Our last one was March the 10th of 2020, just before. And our main topic in that one was COVID. Okay. Oh, another thing we do is to talk to elected officials. So if you are friends with the county commissioners or town boards, let us know. They have some influence. Okay, Reese is going to talk about what's coming up and about what's right now on everybody's mind. So go ahead, Reese.
I'm going to hang back here so I can toggle through and remember what the slides say. So as Susan just implied, about a month ago now, I guess, we became aware of the North Carolina Department of Health and Human Services bringing Summer Back program, which is where some of this fun stuff that's sitting around the room came from. We went ahead and applied, and as did MCHP, some other organizations in the community, Partners Aligned Toward Health. And what that gave us access to was a toolkit of communications information, as well as the, actually, we didn't put many of these out. I will walk up here and say, if you got grandkids coming in, all these free sunglasses, we truly have lots and lots of sunglasses. All that swag sitting there in the center of the room is from them. They are looking for, you know, I'm going to call them local trusted leaders to talk to the community and explain, for instance, why this little chart right here, this is my cousin from Avery County, and he's got this little orange sign that says why I got my shot, and he says, because I don't want to be stuck quarantining in my dorm room. So last year when he was down at UNC Charlotte, much of the time, he got COVID at one point, but then later, if he was, you know, not feeling well, he had to quarantine. So they gave us lots of stuff to pass out. I'm not saying that everybody in this room has to have the vaccine. There's some valid reasons some people don't have the vaccine. But when he came to work for my husband one weekend recently, he said, well, you know, it's just too hard to get. And I'm like, just go to Ingalls. So he went to Ingalls and he came back and filled out his sign that we can put on our Facebook page to talk about, you know, why some people have gone ahead and done it. As Susan implied, the bigger flyers, there's some sitting up there, MCHP actually paid for, and it's a local flyer, one for Mitchell County, one for Yancey County, that gives the health department's phone number so that you can call and find out where you can go to get a vaccine. As Susan implied earlier, there were more vaccine clinics being held, but I think, and Chuck will correct me if I say this incorrectly, there was such a surge. A lot of us that are in the upper age group sitting in this room, when they became available, a bunch of us sort of clogged up and went to get them. There's been a real slowing down of that. And so I'm going to go on to the next slide, and I'm sure it's difficult for y'all to see, so I'm going to point here and talk about the numbers that are currently the percentages in the country, the state, and then our 3 local counties that are fully vaccinated, as opposed to, you know, at least gotten 1 shot. So the numbers, and I know you can't read them, so I'm going to turn around and see what they say. So I'm going to focus on fully vaccinated because I think that's kind of where we want to be. So in our country, on the 15th, 2 days ago, 43.7% of our population in the country is fully vaccinated. In North Carolina, 41.9%, you know, very similar. Avery County, 40%. Mitchell County, we're always lagging. We're 34%. And Yancey County right now is 37%. So that's an interesting number, 34%, about a third of Mitchell County. We've got about 15,000 people. That really means 10,000 people in our county are not fully vaccinated. And the other image that was on that previous slide tries to remind people from the Department of Health and Human Services. I'm going to back up and see if y'all can see it. The one over here, it says vax up or mask up. And we can't forget the kids that are younger than 12 can't get vaccinated right now. If you see them out in public, it would be better if they're vaccinated. They all have to go back to school soon. And so
The next chart I wanted to talk about, and I didn't really do much to introduce myself. I was a math major. Can you tell? Look at all of these charts of graphics and all that. I know you can barely see this, but I hope you can see that there's a bunch of colored lines. And what happened is the top two lines, that was originally aged 75 and older, and then the second line is age 65 and older. When those vaccines became available, the chart goes whoop, and then it levels out at about 60%. So even us older folks, we're about 60% vaccinated. But the lines coming down, I've got to clean out here and see what the numbers are. For 50 to 64%, they're at like 39, 38%, 28%. And right now in our two local counties, the 12 years old to 17 years old, they're only at 1 or 2%. Across the state, they're at 8%. I don't know which counties are jumping ahead and getting the young kids done. And when Susan mentioned Madison County earlier, before school ended, they went in and did vaccine clinics in the schools. So that kind of brings us to the topic that a part why we're happy to talk to you all. We're looking for ways to partner with other organizations. We've been doing a lot with MCHP. We've been talking to Colby a lot lately about things that are going on in the community through the hospital. About sort of forming some collaboration. So I'm going to pause and say one more thing about the independent monitor. I don't plan to go a whole lot into the sale of the hospital a couple of years ago now to HCA and the setting up of the independent monitor, but we stay in close contact with them. HCA has to publish a series of reports every year. Those came out recently. The independent monitor had a big public meeting for the whole western end of the state on the 7th of April. And then actually on the 27th of May, we were in on a call that was targeting more of our area. We had people from Mitchell and Yancey County. 5 of us on the call were from Surge. We had Vern Grindstaff there. We had Steve Pittman, just talking about our perceptions. It was good to have the commissioners there. They're always happy to tell people how much they hear from the community. In fact, I think it was Steve Pittman that said, please come talk to our nurses at the hospital. They have concerns. And the independent monitor did make it clear in their reporting to the community, even though there have been a lot of concerns about non-compliance with what the asset purchase agreement said a couple of years ago. To date, they have not found any events that are out of compliance. Now, there have been a lot of people that have had issues with the hospital, paying their bills, other issues, but not non-compliance. And so we are dedicated to the mission of staying in touch with the independent monitor. On our website, we have all the ways you can lodge concerns, complaints, or even good things about the hospital. Whether it's through the independent monitor, through the regulatory bodies in the state and all. So I'm going to go on and talk about what I was mentioning a minute ago. In the last year, particularly not being able to be out with the public, we've really thought about how we want to become more of a collaborating, sort of a gluing backbone organization. That's what Search is. This week, with all this swag that has been crowding my garage and my car, I've been meeting with Partners Aligned Toward Health, who do a bunch of those summer festivities in Burnsville, taking them 150 sunglasses and 250 Frisbees and all of that. The Blue Ridge Partnership for Children, they've gotten theirs. Head Start. Those organizations are doing direct service with people, mostly children and families, which is a great target for this kind of information. But we are trying to be more of a connector, sharing information, alerting the public when we want them to be talking to elected officials, as Susan said earlier in her part of the speech. And so that's what we're about right now. And if y'all are sitting here, have any questions, have any ideas, y'all are our first time to go out and speak in public about the new role that we have now that we've actually got a fair amount of funding coming in. We're desperately looking for some help to get this done. And the other thing we're going to buy is our own projector and our own speaker system for when we go out and speak in public. So the slide that you see here, again, you probably can't read it, but we've got a committee chaired by Lee Rule, who is a surgical nurse at the hospital. Called Championing and Monitoring Healthcare. So we certainly don't want to look like we're always just the naysayers and complaining. Every time we start talking to somebody in a position that's elected official or someone at the hospital, we want our hospital to stay here. My grandfather was on the board of that hospital for the first 20 years it was in operation. And he was a member of this Spruce Rotary Club for a long, long, long time until he passed away in the mid-'80s. He would be proud that I'm here speaking to you. So we want our hospital to stay. We want MCHP to be successful. The independent doctors like Chad Smoker and Bree Faulkner, we need it all to stay here so that we cannot have to go to Asheville if we, have a minor issue. So this chart shows our 2 counties, Mitchell and Yancey County. We keep trying to infiltrate up into Avery County, but we haven't been as successful up there. Working on a collaborative that has to do with the healthcare providers. I'm pointing to Chuck and to Colby. I'm going to sit down and read what these words say. Other nonprofits, civic clubs like the one we're sitting here with, elected officials, just residents, funders, businesses and industry, economic development, and the school system, so that if something happens like a COVID pandemic, we know who to talk to. We know how to make something happen. We have email lists and phones that we can get on. When the shots started coming out, a friend of mine in Orlando, Florida, that I knew for years before we moved here, she called me, she said, Risa, my cousin in Gaston County, they came to his farm and gave him his shot on his tractor. I said, I don't even believe that. So I called Gaston County and talked to them, and they have a whole program called Gaston Saves, and they've got a tagline, COVID stops with me. And they've got organizations, they've got a coalition of groups that know how to work together. And when I asked the county workers who had stood up this website, I said, wow, you did all of this for the pandemic. She said, and it's going to be there in the future. When there's a fire, when there's a flood, Gaston Saves will always be there, a website that says, here's what to do, here's who to call, here's how to get a shot, here's how to get help with filing for FEMA if it's a flood or whatever. So we'd like to start putting the idea out there that we need a collaborative way in these communities to be able to react to situations like this. So that's kind of our pitch. I'm going to go to the last slide, which repeats some of the information that's on our delightful little bookmark that Susan and her committee designed, and it's on your tables there. That shows you how to get on our Facebook page or our website or send us an email. Susan's and my personal cards for search are also sitting on the table in the center. So that's kind of the speech. Susan, am I leaving anything out? No. Does anybody have any questions, thoughts, reactions?
My comment is I appreciate the enthusiasm. Both of you.
Oh, it's so good to be out in public.
Yeah.
To a certain extent.
Wonderful. Yeah.
Well, thank you, sir. I appreciate that.
Yeah.
Yes, sir.
I'm a little confused. I'm relatively new to here. I kind of hear a little bit of sense of distrust, but we talk about collaboration. Which way do you lean? Is it
to distrust? Is that what you said?
Yeah.
And where did I say I distrust something? Help me. Let me refer me back to what
I wasn't here with the hospital deal, but I sensed there was a bit of all blue there from folks here.
Before, and as Susan implied earlier, on the 30th of September 2017, our local hospital, which was a nonprofit at that time, closed labor and delivery. And that often around the country is a death knell to a hospital. Now, if you've been to our hospital lately, if you've been into Mossie Phillips building, we have a beautiful hospital that has lots of excellent equipment. I'm pointing to Colby because Tanya Hale, our current CEO of the hospital, she seems to be, she's new, but she is determined to be positive, God bless her, she came in the middle of a pandemic. So we were worried about the future of the hospital. They closed labor and delivery. We always say we want it back, and she understands why we feel that way. Because for our communities to continue to grow, why are young families going to move here if they have to go an hour away to have a baby? But the hospital got sold to a for-profit organization now, which we have some concerns about. But we're monitoring what's going on. We meet with Tanya. We have what's called an outcomes committee, because when they first closed down labor and delivery, we were very worried about a mom having to have her baby on the side of 226 because there was too much snow on the road, she couldn't get down there. And so, happily, there's been some unexpected deliveries in the ER over the last 2.5 years. It's been almost 4 years now, 3.5 years.
15,000, how many deliveries a year are there?
Back when they closed it down, there were just over 200. They were approaching 200 that year, I believe. I'm looking at Susan and Chuck to help me remember.
Yeah.
This year there's how many?
None at Blue Ridge, right? They either have to go to McDowell, or a lot of people go to Johnson City. If you live in the north end of our county, it's better to go over there, or you go to Asheville. And so.
So sort of just kind of monitoring all that goes on.
Yeah. About healthcare, as there's another line that we like to say, we are here to foster and to defend healthcare, because, you know, I only want Mitchell County, Yancey County to grow so much. I don't want us to turn into Asheville. There's too much traffic over there. That's why I left Orlando, Florida. It was too dense. But we don't want to fade out, right? I have a feeling our census this year is going to show that Mitchell County shrank, right? We probably lost 2.5 people in the last decade. So we don't want to get to the point that we only have an emergency room here. We want to be able to go to the hospital. I mean, my husband ended up in the hospital for 5 days this year. I ended up in the hospital when I had a car accident. We want to be able to go to our hospital and get the kind of good local services. If they could ever bring labor delivery back, it would be low-risk pregnancies. If you've got a high-risk pregnancy with an older mom that has, you know, health issues, she should be planning to go to Asheville. But we want to keep local, accessible, affordable health care here. You know, somebody that lives in the middle of our county may only have one car. If their spouse ends up in Asheville, 3 kids at home, they may not even be able to be over there to see that person in the hospital. So local, accessible healthcare is what we're here to foster and defend. Did I help? Did I understand?
Yeah, I come from a market that's a huge market, and we always believe in public hospitals because they do a lot of whatever it is you need. So if you need a certain surgery, the guy doing it, the gal doing it's done it thousands of times. I'm not sure I understand. If there's only going to be 40, 50 births, are you getting as good healthcare as people today? I don't understand.
Well,
how can you get it?
Healthcare. I mean,
there's
our group.
yeah, Art, speak up.
And so that's the kind of care that we no longer can have because they took labor delivery away.
Right.
So we can get quality care. They know when they need to send it down the mountain and get into Johnson City or Asheville. But the other thing is, look at our group. Well, besides a few of the young folks here, you know, we're all seniors. Look at the population in Mitchell. What's keeping us at where we are is the growth in seniors. It's not the young folks. And young folks at the clinic there, you know, we hire a bunch of young folks, and they're getting pregnant left and right, which is great. I had nothing to do with it. We do have that, and they want to be here, but to get the other ones to move in, we need industry, we need care. So yeah, it's.
And the hospital's a big employer too.
Oh, yes, the hospital, and our concern is not with the good folks at Blue Ridge. They do an outstanding job.
Absolutely.
HCA, big corp, they suck. The charity care, which they said when they came in was a bill of goods, it's terrible, and our counties are suffering. Blue Ridge is trying to work with us and do the best we can in charity care, but all the uninsured in this county, in Yancey County, they're getting screwed over by HCA with the lousy charity care. And that's unfortunate. That's what we're screaming at with the independent monitors. Not much they can do about it, because technically HCA is in compliance, it's maddening.
Right.
Anyway, the folks here at the hospital are absolutely wonderful. And they're doing everything they can, and we have good care there.
Good question. Medicaid is changing as of July 1st, and y'all involved in that, or is there any effort to try to communicate, or there's a lot of confusion about it, and whether it's actually going to happen or not?
We're not trained in that.
Yeah.
So we vector folks to MCHP or to experts that know about that. In fact, when we talk to Tanya next go around, we're going to be asking her which programs the hospital will accept. But Medicaid Transformation, which is, I believe, is the program that you're referring to, Marvin. We haven't had time. You know, we are not medical experts nor insurance experts. And so, Susan, is there something else you'd like to say about that?
We pass on messages about it in our e-newsletter. We ask for people who wanted to be trained in it because they're looking for ombudsmen to try to understand it. Neither of us wanted to do that, but there are people in the community, and I don't know if we'll be in a position ever to get into the weeds about that. I think, oh, I know. They did, in Yancey County, there's a group called Healthy Yancey. They meet once a month, and they had a program on it. And our third person, there were 3 of us who started this search. Karen Roulette went to that, and so she's got the information. So we have one sort of local expert, but not really. I'm sure she wouldn't want to be called that. It is, it's not just that. There's another part too, and that is that there's a healthy, what is it? Another.
Have the opportunity?
There's there's another program that Dogwood Health Trust was one of 3 in the state, organizations in the state, that got a grant for a pilot project. And so you're going to be hearing about that too. I mean, there's so much going on that can do some good, but unless people are paying attention, you know, I mean,
Communication.
yeah, so help us get the word out.
Medicaid managed care, the transformation to Medicaid managed care, you know, the legislation all of a sudden, beginning of this year said, yeah, we're going to do it July 1st. And everybody's just been scrambling, trying to catch up. It's tough. And unfortunately, the consumer, the Medicaid patients, they're the ones that are getting the least information. Yeah, so it's, yeah, I mean, we haven't brought it up here at Rotary because most of us are on Medicaid, but getting out to those and trying to find them and communicate to them has been tough.
Well, thank you.
Thank you, ladies. I know I'm biased, but good God, these ladies are just doing you just can't imagine in the community how hard it is. I mean, I'm envious of what Gaston did with Gaston Sage and so forth, but good God, they don't have search. And they may be a little bit ahead of us, but getting that where we are so siloed as an Indian industry, but we're so siloed with the hospital and MCHP and private practices and so forth. And then the organization, everybody wants to work together well, but it's tough. There is a group, the state brought in NC 360 Cares, I think that's what it's called.
Yeah.
In fact, there's a big webinar out this afternoon. That's a program where all the nonprofits and organizations like ours can join in. And if we have a social determinants of health need, we should be able to go to NC 360 and connect that person with that source that can provide that need for them. But typical bureaucratic problem is that it's as the folks around here that provide the food banks, good God, the paperwork that you have to go through and the training just to learn how to get onto NC 360, they just don't have the time and the money and the people that can do that. So there's good ideas, but the execution sometimes gets tough.
Well described.
Yeah, but good golly, y'all do a good job.
Thank you.
Thank you for all y'all do. So, anything else? We'll make calls, get everybody out for the meeting next week. We hope that the weather's like this. It'll just be wonderful. We had a night like this, but we'll call for that, right? We got the Ace of Spades. George, you want to get us going with Ace of Spades?
You want the ladies to stand and take a picture.
Oh, thank you.
Put the paper. This we should do.
All right, you about to draw a ticket?
Yeah, why don't you let Risa draw it?
All right.
She'll pull my number.
It's mathematical.
So I'm getting one of these little blue things.
You can
huh?
look.
I don't want to look here.
Oh, gosh. I find what's left. Okay, the last 4 are 3, 0, 8, 1.
All right, Nelson.
Oh, Nelson.
Nelson.
Go in the car.
Oh.
Okay, now remember, I
The
get
pile's
that.
getting small.
The chances are getting greater.
Yeah, he'll do better than I will. Okay, we'll go this side.
Ooh, you saw it, okay.
Yeah. Ooh, it's a spade, not the right one.
All right.
George, tear that one up. Don't put it back in the pile.
Hope this was the right spade.
It's gone anyway.
It's gone.
Yeah. Well, Marvin, you want to lead us in the Rotary four-way test?
Yes. Four-way test of the things that we think, say, and do. First, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Thank you, everybody.
Bye, Randy.
Thank you, nice meeting you.